This is Counterpoint, and I'm your host, Tanya Granick-Allen. Today, we are taking a closer look at the evolving face of healthcare. For decades, our system has been grounded in a principle we hold dear: care based on need, not the ability to pay. But across the country, pressures are mounting, wait times are growing, costs are rising, and hospitals are struggling to stretch every dollar. So, how do we fix it? One of the answers proposed, and in some provinces already implemented, is something called activity-based funding. It's a shift in how we finance our hospitals. Rather than block funding institutions with a lump sum each year, this model pays based on what hospitals actually do, the number and types of procedures, treatments, and services delivered. The idea? To reward efficiency, reduce waste, and increase accountability. But like any reform, it's not without controversy. Critics warn that it could lead to cherry-picking patients or compromising quality in the name of quantity. Well, tonight we're going to unpack what activity-based funding really means, not just for policy and budgets, but also for patients and providers, and the future of healthcare in Canada. And joining us for that discussion is Colin Craig, president of secondstreet.org, and Krystle Wittevrongle, senior policy analyst at the Montreal Economic Institute. Welcome, Krystle and Colin. Thank you so much for joining me. I love these perennial discussions we have on Canadian healthcare, but of course, with the aim of seeing how we can make it better. So why don't we start with you, Krystle? In your own words, what is activity-based funding and why is it gaining traction in Canada?
So, activity based funding is a shift in the way we're funding hospitals. So, primarily funds based on the activities that are performed, the services and treatments that are actually performed. So, rather than the global budget funding of the past, essentially, we are looking at new ways of funding where the actual number of patients treated, the exact type of care provided to them, is what they are funded for rather than last year's volume of services, which is what global budgets really look at.
And when doing research for the show, because my niche isn't continually healthcare funding, all I could think about is, well, why wouldn't we have done it this way previously? So why was that method of funding chosen as the de rigueur version, if you will?
For global budgets
Yes.
historically. So because it provided a set sum of money for the hospitals to provide the services for the coming year. It was a sort of safety mechanism to ensure funding and to ensure that there would be resources available. However, the issue with this and some of the downsides that we continually see across the country is that it really puts patients as seen as a cost. So every single patient that enters into the hospital
Mm.
costs money for that hospital to treat when it's funded this way, rather than with activity based funding, each patient is seen as an opportunity to receive funding rather than rationing the resources it has historically been given.
Right, I understand. Okay, and Colin, in your organization, secondstreet.org, you often focus on patient choice and efficiency. What do you see as the biggest advantage to switching to activity-based funding for healthcare?
Well, it depends how you do it, but I think in the ideal model, what happens is you take ideology out of healthcare. And what the government says is that, for example, we're going to spend, and I'll make up the number, $10,000 per knee surgery. And you say to patients, it doesn't matter if you choose to get your knee surgery done in a government facility, a nonprofit facility, or a for profit facility. What matters is that they do it right and that you feel that it's the best facility to help you. But you're also signaling to providers that you can enter the market and start providing knee surgery, and you know how much you're going to get paid if you provide that to a patient in the public system. So it totally changes the model. As you know, Tanya, right now we have some people that say, well, the government should be doing all healthcare. That's a very ideological position.
Hmm.
You might even find some people that say it should all be done privately. That's another ideological position. So this way, it's taking ideology out of the equation, and you're just saying anyone who can provide this, because that's really what patients care about. When you talk to most patients, they don't care if it's their healthcare is delivered in a public, private facility. They care about it being done in a quality manner, on time, and they don't want to walk out the door and face a big bill.
Right. And patients like choice. So if, they have a choice of a 6-month wait or a 1-month wait, let them choose. We're going to continue this discussion when we return in just a few moments.